Hi, good morning, everyone. Thanks for coming. Welcome to MD Expo. This is likely your first education session, so we're really happy that you chose to join our session this morning, and we're excited to share a little bit about our experience and perspective on new Joint Commission standards. So we'll jump into it and start with our learning objectives for today, and this will be the foundation of our discussion today. And we invite you to chime in. This is a relatively small group, so if you have comments or questions as we go, feel free to jump in. We're happy to make this a discussion rather than a presentation. So what we're hoping to accomplish today, 3 objectives. First, identify the most HTM relevant changes coming from Accreditation 360. Secondly, understand the impact of Accreditation 360, specifically on HTM. And we found that there have been published by Joint Commission general resources and information on Accreditation 360, but we want to dial into our community here. And then third, some practical applications of strategies to maintain compliance under Accreditation 360. So here's our high-level agenda, aligns very well with our objectives, and we'll have some more time for takeaways and discussion at the end too. But like I said, as we go along, feel free if you have questions to raise your hand or chime in. So we'll start with some introductions and background so you understand who we are and our perspectives. I'm Kenneth Colavito. I'm a consultant with Sigma Health Consulting. I've been working in HTM for about 10 years. I'm not a native HTMer, but I'm a consultant and had an opportunity to get involved with HTM about 10 years ago and have really fallen in love with the industry and the community, and working with VA, the mission to serve veterans and providing them health care. I oversee Sigma's HTM consulting practice, and I'll get into a little bit more about what we do. A lot of what I do personally, aside from oversight of really all the work that we do, communications, policy type work for the VA's vast community of HTM professionals. Something that I will plug, I'm standing up a HTM association in the DC area. So if there's anyone here from the DC area and is looking for opportunities to get engaged in the local HTM community, invite you to connect with me, learn more about it. I put some flyers in the back of the room over by the water if you're interested in getting involved in what we have to offer as a community in the DC area. So a little bit more about Sigma, just to give you a bearing of what we do. Pretty wide range of services from cybersecurity, patient safety, technical standards, program assessment, and some software services around communication, meeting and conference facilitation as well. I will let Shelly introduce herself.
Okay. I'm Shelly Leacock, and I am a biomedical engineer in the VA. I work in the central office for the VA. And is that giving me feedback?
I think I'm doing it. Sorry, Shelly. I'm trying to get it away.
Okay. I've been a biomedical engineer in the VA since 2004, so in my 22nd year here. And I've served at the local level in Portland, Oregon, and then moved on to the regional level in Minnesota. And then since 2012, I've been in our program office. I largely focus on patient safety related issues, managing all the recalls for all 170 sites, and investigating incidents that occur, and also working on little projects like Joint Commission readiness. Right, you have the clicker. Okay. So what is VA? Well, VA has one central office, 18 VISNs. You may have heard in the news that's going to be reducing, but we don't even know what that looks like yet. Medical centers, depending on how you count. And then we've got over $10 billion of healthcare technology management across our enterprise. Over 1 million medical devices and clinical systems, and around 2,200 HTM professionals, engineers, and technicians. So we've got quite a breadth of experience and knowledge across our enterprise. And with that, I'm going to turn it back to Kenny for the next portion.
All right, thanks, Shelly. So we'll talk a little bit just to give us a level set of Joint Commission. I think most people here probably know what Joint Commission is, but very foundationally, an independent accrediting body in healthcare. Evaluation, accreditation of healthcare organizations across the country, 2,200 of them, or 22,000 of them, I should say. And typically every 3 years, healthcare organizations are surveyed unless there's a for cause survey. And the objective overall for Joint Commission is to improve quality and safety of healthcare delivery for patients. So I want to do some informal polling as we get in more into Joint Commission and Accreditation 360. And how is everyone feeling about Accreditation 360? So I'd like you to raise your hand and give me a signal 1, 2, 3, 4, or 5, 1 being least nervous or anxious about Accreditation 360, and 5 being very anxious. So invite everybody to put up their hands enthusiastically as high as you can reach so we can see it. Okay, so I think we have a pretty good range of anxiety. But that's why we're here, to talk through it, and hopefully we can help everyone feel a little bit more confident and comfortable with the changes. So what is Accreditation 360? It's the most significant accreditation change update since 1965, which is quite a long time. And Joint Commission, this is straight from Joint Commission's messaging around what its objective is. It's really to reduce burden, make standards lighter, but maintain their rigor or sharpness. So went into effect at the beginning of 2026, so it is live now, and we'll talk about some experiences with Joint Commission. At the VA, we've had several sites already this year go through Joint Commission surveys, so we'll talk a little bit about that. Another informal poll, how many people here are at healthcare organizations that are expecting a survey this year? Have you already, or? Okay. Anybody else this year? Already, or no? Okay. Okay. And anyone next year, in a year? Okay. 2 years? Okay. All right, so pretty wide range too, what when people are expecting to see this. So the changes around that are coming from Accreditation 360, a reduction in the number of requirements. And more than 700 requirements have been affected by this, and that's on top of 400 that were recently already reduced in 2023. So really much lighter standards, at least from a contextual standpoint. Introduction of national performance goals. So those are really replacing national patient safety goals. So it's a broadening of those goals, but somewhat similar in concept. Formation of a physical environment chapter. So that's a consolidation of the chapters that have been very familiar to HTM audiences. So that's environment of care and life safety chapters have been kind of melded into this physical environment chapter. And then revision of the survey process guide. So formally it's been the survey activity guide, and the survey process guide is really a very long document, 700 pages, which is the guide that surveyors use to conduct surveys. So it gives the community insight into the process. And really this has become, in our opinion, a very important document now because the requirements themselves have been lightened by so much that a lot of the detail can be found in the survey process guide. So this is the biggest takeaway of what we'll talk about this morning. And this is the messaging from Joint Commission, and we'll talk more about our perspective on it. But Accreditation 360 does not introduce any new expectations, and that includes for HTM. So if you've been compliant in recent years, you should expect to be compliant under Accreditation 360 or in 2026 and beyond. So there are a lot of changes, a lot of swirl, a lot of anxiety around Accreditation 360, but if you've been running a program that is sound and compliant in years past, continue doing what you're doing, and we'll talk through some of those things too as we work through our discussion this morning. So to validate this messaging from Joint Commission, we took a deep dive into the materials that came out June of last year and have been updated in recent months as well. Looking at the survey process guide, the standards, and the crosswalks that have been provided by Joint Commission that are, again, more broad, not necessarily honed in on HTM standards. But we identified close to 80 HTM specific standards and looked at how they've been remapped, so to say, through Accreditation 360. So the biggest number here, which is 34, may be difficult to read in the back, but those have been replaced by a more direct EP. So if you look at them very closely, most of them, or a good chunk of those, it's very like a one-sentence standard. So it's a very broad standard now, which is essentially like take care of medical equipment, manage medical equipment. So there's a lot of context that goes along with those in the survey process guide with more details on what's expected. The next number moved and revised is 13, deleted and replaced by survey process guide expectations. So again, there's a lot of information in that survey process guide about expectations. Another 11 consolidated, 5 moved, 3 split, and 2 deleted. The ones that were deleted, one was about leadership making safety alert systems a priority. My thinking on that is that that's kind of like been a priority now felt like it was not necessary to continue that. And the other was to have a library of documentation around manuals and so on, which we think is still a best practice to have that library, but no longer a expectation necessarily. Okay, so examples of continuing expectations, and some of these may not be as explicitly noted in Joint Commission standards any longer, and may be kind of displaced or replaced into the survey process guide, but within VA, continuing to encourage all of these as best practices to maintain compliance. Having a medical equipment management plan, a document that spells out governance for HTM, HTM's management of medical equipment, to document expectations, and pretty much a lot of compliance, in my opinion, is writing down what you're going to do and then doing what you said you were going to do. Inventory, maintaining an inventory of medical equipment, and that includes noting high-risk equipment in the inventory, so that remains an expectation. Identifying and documenting maintenance activities, again, very foundational to HTM. PM compliance, completing PM on schedule 100% of the time for both high risk and non-high risk equipment. AEM program, if you are using AEM, to be sure that that's properly documented and justified. Alerts and recalls, mitigating risks associated with alerts and recalls, which is a heavy load and burden to do, but still necessary, very much so. And then regulatory compliance, aside from Joint Commission, facilities, and other safety codes, being sure that those are being followed. So I mentioned earlier that we've had several VA sites already participate in Joint Commission surveys this year. So we collected some information from those sites and wanted to share some of these results with you, and we'll intend to continue to collect this information and share as we can. And interested to hear from all of you when you participate in Joint Commission surveys, what your experiences are as well. So of the 5 sites that participated in a survey already this year, just 1 of 5 had a noted HTM-related finding, and that's a preliminary finding, and it was related to PM. So I feel like that's pretty good, considering we've already had 5 sites undergo Joint Commission. None of the 5 notated significant difference in their survey from their previous experiences. So that again validates that while there are a lot of changes that are occurring with Joint Commission as far as documentation and materials that are shared from Joint Commission, the impacts are relatively minimal from an expectations and practical standpoint. Just 2 of the noted that surveyors mentioned Accreditation 360 specifically. So there is still quite a bit of variability in messaging from Joint Commission surveyors about Accreditation 360 and the changes that are coming from them. To give you some insights into documentation that's been requested by surveyors, that's what we have in this graph here at the bottom left. So this is all based on the 5 sites that have been surveyed so far. So PM records is the most recurrent documentation that's been requested, and that's both high risk and non-high risk. So those are represented in the first 2 bars of that graph there. Medical equipment inventory, manufacturer documents next, and those specifically related to EEDs. Felt like that was interesting, but maybe a trend there. One requested a map and another sterilizer performance testing documentation. HTM's role in the surveys, all 5 of the sites, HTM folks answered questions to surveyors, and then kind of a varying level across these other activities, pre-survey equipment sweeps. So that's just a good practice to participate in if you're getting ready for a survey. AOC rounds, and we'll talk about some of these too in a bit more detail. Mock surveys, pre-survey, serving as an internal SME on Joint Commission standards, and then also collecting documentation as needed. I'll turn it over to Shelly. She'll tell us a little bit more about strategies to maintain compliance.
Thank you. Situated. Okay, so we're going to step through HTM best practices to build confidence in Joint Commission compliance. So first of all, Kenny mentioned that a good practice is to be a part of your EOC rounds or your environment of care rounds. And if you noticed on Kenny's graph, not all 5 of the sites that had a recent Joint Commission survey indicated that they participate in EOC rounds. I sincerely hope that all of you are participating in your environment of care rounds to look for things the Joint Commission would look for. It's a great way to spot those tags that might have, equipment tags that might have just passed their due date and got missed, or maybe it was a piece of equipment that couldn't be located for a long time and you find it on an EOC round. I'll note that I go on 3 or 4 hospital inspections every year across our VA sites, and we always find things when we're doing Joint Commission tracers in different areas of the hospital. We always find outdated tags, inconsistent tags, and so it's really important to go on those EOC rounds, but not just to look at your equipment tags. You want to talk to your nursing staff and clinical staff in those areas. Make sure they know how to use the equipment. Make sure they know who to call when something doesn't work correctly. Make sure they're getting good service from clinical engineering. And of course, you're looking at the tags also, but you want to make sure that the clinical staff have written procedures to follow when the equipment fails. And do they know what the tag means? Do your nursing staff know what that equipment tag means? And a lot of times the answer is no, and you have to do on-the-spot education, right? But that's another reason to get involved with your nursing education programs, not just when you're doing EOC rounds, but maybe attending new employee orientation to give a little briefer on that, or going to a clinical area staff meeting to talk about equipment safety and making sure that your clinical staff really know what those tags mean and why they're important. We want to make sure that end users have appropriate training on medical equipment, that the condition of the medical equipment is in good condition with no obvious damage when we're walking through areas, that they know how to purchase equipment and get clinical engineering's input on what they purchase to ensure that it's safe for use and that it's FDA cleared or has a consensus standard against it or whatever the case may be. We want to make sure that staff know how to enter work orders when they need to, and last but not least, we have on there the current inspection sticker, which we've already covered. Okay. Did I skip one? I'm sorry. Nope. All right, next we want to focus in on conducting tracer rounds. So you'll notice we're not going to hit every one of these points. Performing mock Joint Commission surveys goes hand in hand with your EOC rounds, for instance. So as far as conducting tracer rounds, and that goes hand in hand here too. We want to make sure as we're doing those EOC rounds, we record the numbers, the equipment asset tag number, what identifier, and we go back into our CMMS, no matter what CMMS you're using, your computerized maintenance system, and trace it. Make sure it has an incoming inspection. Make sure it's up to date in its PMs and that no PMs were missed. If something fails about that piece of equipment, did it get fixed? All those types of things. So you can also ask staff questions, review documentation, and observe the equipment in use to make sure it meets those Joint Commission standards. All right, and now we're going to dive a little bit more into providing ongoing user and service training. So our end users cannot answer the right questions about their medical equipment if they don't know how to use it. And we've found through our incident investigations that we've tracked over in VA, so across 170 hospitals over the past 10 years or so. This data is showing since 2020. We actually have data going back further than that. But it's consistently, we're not all the way through the year at this point, so we're only in April, but which is about halfway through the VA's year because our fiscal year starts in October. But consistently, year after year, we've got about half of our incidents, the root cause is found to be a use issue. And this is very consistent year to year, and it points to an education gap on the safe and correct use of medical devices for clinical staff, especially your nurses and doctors. And HTM does need to put more emphasis on recurring clinical staff education. Think about your pain points when it comes to doing your Joint Commission survey or your EOC rounds, and questions that Joint Commission would ask your clinical staff or look for. You want to make sure they know how to not only use the defib that's on the cart, but is it oriented correctly? We had an incident occur where the defib was turned up on its side and it wasn't working correctly. So, you know, little things like that. You know, points where fires are always of concern, right? Smoke and fire, charred, burning, you know, things, cords get pinched. Do staff know how to properly manage the bed cords or the EKG cords or whatever so that it doesn't get pinched and then result in a fire? Do they know how to properly store the equipment so that cords don't get pinched? We had a lot of that happen with our EKG carts over the years, those acquisition module holders, and the cords getting pinched in there. Okay, and now we're going to focus in on monitoring performance against our KPIs, or our key performance indicators. So how do we know we're doing a good job? You have to keep your eye on the target. Now, I know that the new Joint Commission standards don't specifically call out for having a medical equipment management plan, Do you need to have one still? Yes, you do. Because how else are you going to know that you're doing what you need to do? You plan it, you document it, you follow up on the plan, and you document your findings. And that turns into our KPIs, our key performance indicators. This is a fake scorecard from VA Hospital XYZ, and it actually represents no hospital. But anyways, these are the metrics we look at. We look at patient safety requirements. Are you getting your recalls addressed? And do you have any actions that are lingering out there that need to be addressed? Do you have a proper inventory? That's our, and are you calling an EKG machine an EKG machine, or in some instances, is it an ECG machine or an electrocardiogram machine? You know, so you've got to have that consistency. We like to base our consistency off of the ECRI's universal nomenclature. And we've had to modify it to fit into our CMMS systems, but in any event, it's a great standard to follow for ensuring you have accurate inventory that's consistent across device to device. Medical device security. Do you have equipment with unsupported operating systems? And if you do, what's the plan to fix that? Vulnerability management. Are you scanning your devices and patching and putting security patches on a monthly basis? And then medical device sustainment. Obviously, your PMs are very important for your high risk and non-high risk PMs. And we track corrective maintenance work orders that are completed within 7 days as well. And last but not least, hours documented. If it's not documented, it's not done. We all know that saying. So we have a target for our sites to, including myself, to document 70% of our time. Obviously, we want our technical staff to receive training like we're all getting here. And we measure our customer satisfaction through survey results that we get. All right. Right, and then assessing your HTM program annually. We have a requirement in VA for a complete comprehensive program assessment to be done once every 2 years at every site. And this is how we really know that our programs are doing well. It's a full week at a site, and not just looking at Joint Commission tracers, not just doing EOC rounds, but looking at all of the policies, interviewing all of the departments that we can get our hands on, and really looking for best practices and gaps that need to be addressed to improve the program. So we evaluate program maturity using assessment resources. We look at all the KPIs that I just discussed. We analyze and trend results year over year, set goals and develop action plans, improve program utilizing and routinely reviewing action plans, and then monitor and communicate those results to leadership. And leadership really likes those assessments. All right, I'm going to hand it back to Kenny to finish us up.
All right, thanks, Shelly. So to recap some of what we feel are the biggest things to take with you when you leave the MD Expo this week and bring back with you. Number one, don't panic. Hopefully we've given you some reassurance that we're expecting, and from what we've seen, the impacts of Joint Commission Accreditation 360 to be on HTM are relatively minimal from a practical standpoint. So again, if you've been compliant in the past, and especially in 2025, that should translate to this year. So if you were high on our anxiety scale at the beginning of our presentation, hopefully we've knocked you down a point or two in that regard. So hope you can take that back with you. Maintain best practices for compliance We've talked about a number of those today, and if some of those strategies you're using, that's great. If you're not using all of those, maybe consider implementing some of them. And if you're looking for folks to talk about those strategies with in more detail, we're here. So reach out, connect with us, and we love talking HTM. So I invite you to talk with us about that. And that goes along with number 3 too, share with the community. That's what's so great about HTM. That's why I've fallen in love with this line of work, is the community that we have here at HTM, and this event, MD Expo, is representative of that. With so many people here, we have a community. So talk about your experiences, learn from others, so that we can revalidate the expectations from Joint Commission. And if we're seeing things that are different, or you're experiencing things that are different from what we're experiencing, we want to know about that too, so we can figure out why there's misalignment there.